Let's also get you all the latest updates of the fight against coronavirus, how we're doing particularly on the vaccine front. Private hospitals are now gearing up to join the second phase of vaccination drive against coronavirus. The government has designated 24,000 private hospitals to vaccinate people, and this will be from March 1st. Only hospitals listed under the Pradhan Mantri Jan Arogya Yojana have been chosen for phase 2 of the vaccination drive, under which people over 60 years of age and those above 45 with comorbidities will be vaccinated. As per initial discussions in the Health Ministry, the private hospitals may not be allowed to sell the doses but may charge a nominal fee for administering COVID vaccines, as the Health Ministry is yet to fix the vaccine selling price for private players. There is no clarity yet on whether people will be allowed to choose which vaccine they want to take, whether it's Covaxin or Covishield. The WHO chief, meanwhile, has thanked India for supporting over 60 countries for vaccine procurement, asking other countries to follow suit and follow our example. Let's get to a special segment this morning on coronavirus, the good, bad and ugly news.
There's good news because not just the 60-year-olds who were earlier the priority group to get the vaccines from the government, but even if you are above the age of 45 years and have comorbidities, you are eligible to get the COVID-19 jab. The government has said that those above 45 age can go to either government facilities or private facilities to get the COVID-19 shot. In fact, there are 10,000 such government facilities where the vaccine will be given free of charge, and at private facilities, which are 20,000, a price will need to be paid. But those above 45 age have to remember that they have to show proof of their comorbidities. So, for example, if you have diabetes or if you are hypertensive, if you're on coagulants or any other comorbid issue, you will need to show a proof that you can procure from your clinician or doctor that you've been consulting. So therefore, not just the 60-year-olds, but also the 45-plus category of people can now get inoculated against the COVID-19 virus. Well, some bad news now emerging on the virulent strains front. We already know about the UK strain, the South African strain and the Brazilian strain. But the New York City is looking at a new and virulent form of the COVID-19 virus strain. In fact, the researchers there are saying that it's responsible for at least 12% of the COVID-19 cases in New York City. The strain has been named B1526 and it has similar properties to the United Kingdom strain. But there's a possibility that the vaccines may get another booster shot in the US so that more protection is created against the virus. Now, this is bad news because we already have 3 strains in India, the UK strain, the South African and the Brazilian strain. But at this point, the government has said there's nothing to worry, and the vaccines that we have in India, which is Covishield and Covaxin, are seen to be working against the virus strains. Well, news on the ugly side of the COVID-19 pandemic is emerging from Maharashtra once again, in the Washim district that has been used for flouting social distancing and COVID norms. Now, 229 teachers as well as those living in the hostel in Washim district have tested positive for COVID-19. The area has now become a containment zone. This was after the RT-PCR tests of about 327 people were done, and out of that, shockingly, 229 have tested positive. That's the total figure that we're getting to you right now. Initially, there were 21 who had started testing positive from that place. And also the fact that there's been a spurt of coronavirus cases in Maharashtra. All these students are mostly from districts of Amravati, Yavatmal and Hingoli and other neighboring districts that are witnessing a massive surge in COVID-19 cases in Maharashtra.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.